The nice thing about radiology is you're basically solving puzzles. And I've always liked doing puzzles. And the art of interpreting mammograms is learning how to do that. I'm Edward Sickles. I'm Professor Emeritus of Radiology, and my entire career has been at UCSF.
At the very beginning of my journey in medicine, when HIV was just becoming something that was devastating the world, UCSF stepped up and didn't shy away from treating and caring for people who were living with HIV. And so that makes me very proud to be a UCSF alum. My name is Susan Buchbinder, and I graduated from the UCSF School of Medicine in 1984.
I ended up at UCSF as a traveling nurse to work in the emergency department, and that is where my path towards becoming a nurse scientist really started. I'm Jessica Zègre-Hemsey. I graduated from the UCSF School of Nursing in 2011. After I graduated from UCSF, I then went on to take a position here at UNC in North Carolina as a nurse scientist and an associate professor with tenure.
I came to UCSF because it was not only my first choice, but also at that time the best training place in the country, and did a radiology residency and a clinical fellowship, after which I was hired on as a member of the Department of Radiology, specifically to do mammography, because that was the clinical need at the time.
I've been working in HIV prevention for decades. Currently, I'm the director of Bridge HIV, and Bridge HIV is an HIV and sexually transmitted infection prevention unit that's housed at the health department. On a day-to-day basis, I work on a number of different research projects. We are both part of several prevention trials networks, but we also launch many of our own studies to ask specific questions, and generally it's about how do we better prevent HIV, and we do that both locally and globally.
With my research work, the first major thing that I did was develop a technology called magnification mammography. Instead of getting pictures at life size, they're pictures that are much bigger and at finer detail, which of course is what allows us to see very, very small breast cancers. We know that if you find cancer earlier, our treatments are more effective. It's very heartwarming to know that the research you developed is affecting lives of people all over the world, millions and millions of women.
One of my priorities as a nurse scientist is to improve access to life-saving care. In the back of an ambulance, we have been able to integrate non-invasive heart monitoring technology, which allows EMS clinicians to identify heart problems earlier on and make decisions in the back of an ambulance before a patient has reached the emergency room. It is critically important that we integrate innovation and technology to reach people faster so that they, in the long term, have better outcomes. And an area of my research that is seeking to do that is with automatic external defibrillators, or AEDs. Public access AEDs can be very challenging to access for a number of reasons. Often, AEDs were behind locked doors, and they were not readily visible to bystanders witnessing a cardiac arrest. And my team here at UNC, we are studying how to equip drones with AEDs to be able to improve the time to intervention in out-of-hospital cardiac arrest. We have been leading this work, and we are very eager to advance that science to augment our current EMS systems of care.
HIV treatment and prevention research has really fundamentally changed the nature of HIV. The part that I've worked on has really been predominantly in the prevention field, in developing pre-exposure prophylaxis, or PrEP, which is taking a medicine, either as a pill or a shot, to try to prevent HIV acquisition. And I've been involved both in helping to test the different drugs that have been used as PrEP, but also in ways to try to find ways to support people in choosing what kind of PrEP will work best for them. And we're able to prevent millions of new infections each year around the world with PrEP. We've worked very closely with the community. I've learned a tremendous amount from my colleagues, and we've done this all collaboratively, and I feel very special to have been a part of moving this forward.
Having worked at UCSF virtually all my professional life, it's enabled me to be a philanthropist and donate money back to UCSF. If something like the place where you trained at helped develop you as a person, you have a responsibility to return some of that. And I feel that, my wife feels that, and that's why we have established the Distinguished Professorship in the Department of Radiology and Breast Imaging. And for all of the future radiologists, I hope they're able to contribute by doing research to help improve our specialty even more than I've been able to do. And I expect that will happen.